I'm Flora Pastorero. The Pennsylvania Alliance to Control Tobacco and the American Lung Association in Pennsylvania are on a mission to save lives, and they're trying to do that with education, advocacy, and awareness. And this is especially important in light of the COVID-19 pandemic. Mark Singel is our former state lieutenant governor. He's also a former acting governor. Mark, about 20 years ago, the tobacco companies came together and they came up with a master settlement fund. You were a part of all of that. Can you give us some insight and take us back 20 years?
Yeah, first of all, greetings to all my friends at the ALA and PAC. And you're right. I go back to 2001. That's through the tenure of 4 separate governors. And I remember when the master settlement agreement was arrived at, the courts said that we should focus those monies on health-related purposes, not the least of which was prevention and cessation. Unfortunately, we are far below the 12% of the funds that were recommended for prevention and cessation. We're now down to 4.5, and that is not good policy.
Did these anti-smoking and cessation programs work especially to prevent teens from smoking?
Absolutely. I think that the American Lung Association has done an excellent job over the years of demonstrating through reports and studies just how effective these monies are. In fact, I think it's fair to say that for every dollar that's invested in prevention and cessation, we see a return of about $10. So it just stands to reason that you want to invest in these monies because you're going to curtail your healthcare costs on the back end.
How has the pandemic really changed the conversation about smoking and these cessation programs?
Well, the real tragedy of COVID-19 is that it attacks the respiratory system. That's why we're in need of ventilators and all those kinds of associated pieces of medical equipment. So what you need to do is to reduce the vulnerable population. And there's nobody more vulnerable to COVID-19 right now than people whose lungs are compromised. So it stands to reason that it means more right now during the pandemic.
Pennsylvania is asking for about $15 million, part of that tobacco settlement money. Why is it so important for Pennsylvania to get those funds?
The $15 million are the kind of the tools that we need. That's the money that we need for the programs to instruct people and to guide them toward quitting cigarette smoking and prevention in the first place. But it should be more than that. The $15 million really should be a little more like $45 million. And that would have a return in excess of $450 million to the benefit of all Pennsylvanians.
All right. Thank you so much, Mark. Now, all of this will be part of a Day at the Capitol, a virtual town hall. It's going on Tuesday, May 5th at noon. Everyone is invited to participate. You can even ask questions. The virtual town hall is free. It's informative. And all you have to do is register at the link you see there on your screen.